Good afternoon. My name is Andrew Ham, and I will be going over the finances, risk, and data costs that are concerned with renovating a healthcare organization. Healthcare organization that we'll be looking at today will be in Charlotte Hall, Maryland. So the project proposal will be the renovation of the Charlotte Hall facility in Maryland. We'll also go over explanation and challenges, as well as pros, cons, and the ultimate conclusion for this proposal. Finances, risk, and cost data. The project proposal for the renovation of the existing healthcare organization in Charlotte Hall, Maryland. You can see there are a lot of different numbers concerning the patient volume, aptitude, as well as budget, and the population of Charlotte Hall. It also breaks down the current charge for the basic hospital stay each night, as well as the most recent fiscal year payers breakdown. And these are broken down with 33% for Medicare, private insurance, self-pay, and international patients, and 1% for indigent care. In explanations and challenges with renovating a healthcare organization, the explanation is that renovating a healthcare organization can be risky, but ultimately worth the cost. The renovation of the healthcare organization will hit a desired goal to expand the product and quality of the programs and care. It also elevate the aesthetics in the organization, resolve patient and healthcare workers' issues, and also improve experiences for the patient and staff, as well as improving an overall image for the community with the healthcare organization in mind. There are challenges, obviously lots of patient complaints over physician and nurse not just rushing through their care, but not following up with them in a timely manner, not communicating from one organization to another organization, as well as department to department head, section to section, so on and so forth. They also had complaints over not being able to get the information that they desired at the time that they desired, as well as having cramped or smaller rooms, older building, as well as not enough parking, and also patients seem to think that the ratio of the physician and the nurses are too low for the staffing needs. So with all that in mind, there are pros and cons with the financing risk and cost data according to a renovation. Pros would be renovating the facility would provide newer technology, aesthetics, process quality of care, programs, newer tools, the ability to maximize the square footage that you already have on hand, as well as improve it for the benefits of the patients and the workers, and integrate and streamline processes throughout the facility to get that one-on-one care that the patients need, as well as improving those losses or dropouts that they've had in the past. It will also improve and maximize that square footage that will allow for more adequate parking, as well as more adequate spacing in each section. And it will also utilize the max capacity for patrons as well as staffing in those areas to give the best flow for patients. There are cons. Cost is always a con. Risk of not generating new population traffic to afford the cost of the renovation. Luckily, we do have set aside some funding for this, so we'll be able to get this generated without having to worry about that, but we will be closely monitoring the generation of new population traffic. Another con would be keeping the same square footage as before, and the challenges with that, as well as temporary shutdowns when renovating through the healthcare organization from one section to another. But overall, I do think this is the right project to go with for this facility, as well as In conclusion of that, you can see that the expansions, renovations, and integrations of electronic health records are all expensive and time-consuming, but there are pros and cons to all of them. But the renovation will be the best one for this facility, as it will give the most solutions to the most problems that the patients and staff had, as well as it will give a new aesthetic, new feel, and maximization of the space allotted. And it will ultimately streamline processes that will bring about the integration of EHRs and possible expansions in the future. And that's all for the Charlotte Hall, Maryland renovation proposal. Thank you.